the reason why I'm here, I'm not going to give you a lot of statistics. I'm not going to give you a lot of bureaucracy. What I'm going to give you is, I'm going to give you personal stories of unintended consequences that I have run into in my practice over the past 15 years. And so, please bear with me. It's just right here. So just bear with me. I took some notes, a whole book full of notes, but I want to try to be as concise as possible, so I'm going to do my best not to share too much, overshare. So first of all, I just want to thank you for allowing me to be here and allowing me to share my story. And Dr. Zwelling, thank you so much for the work that you've done. And I just appreciate Dr. Mass and Dr. Zellers and just everybody. Thank you so much for letting me come and tell my story. And to be honest with you, I did not know. I felt the frustrations, but sometimes we're kind of in a glass bubble, and we're just, our noses are to the grindstone. We're trying to take care of our patients, and we don't realize that there are people who are fighting for us, and I appreciate it so much. So I also want to just commend everybody who's here today, because if you're here on a Sunday, you care about other people, and that's pretty amazing, and you are to be commended for being here, and I just want to thank you. So I'm a physician. The reason why I'm here is to advocate for health care. I'm not here to advocate for health coverage. I'm here to advocate for health care for my patients. And I want to tell you something, every one of you are potentially my patients. When I walk into a room, I am a physician, and when I look at every single one of you, there's the potential that at any point you could drop, and I would be there in a second with my reflexes to take care of you. So every one of you, I am advocating for every single one of you that you need health care. And it doesn't matter whether you have the ability to pay me. It doesn't matter whether you're poor or whether you're wealthy. I would be there. I would come to your aid in a second with no questions asked. In this country, unfortunately, we have tied the hands of our physicians. And I will just give you a little bit of a background, why I'm here and how important it is for me to be here. And this isn't to pat myself on the back, but I will tell you that I worked a 36-hour shift in a rural community hospital, and then I drove 2 hours back to my home, which is sort of in the metro suburban of Kansas City. I packed up my 4 kids, and we started out at 11 o'clock at night, and we packed a 17-hour trip into 23 hours, and we got here late last night because it was so important to me to be here to explain to you the unintended consequences that we are seeing constantly. And they're unintended consequences of well-meaning intentions and well-intentioned regulations. But unfortunately, when you get to the boots on the ground, which is us, they're not playing out in ways that are good for our patients. In fact, sometimes they have disastrous consequences. So my background is that I graduated from residency in 2002. Immediately, I went into a hospital-based practice in a large hospital in Kansas City in the metro. Then I went to a suburban of Seattle for 2 years and worked. And then I had 2 children in that period of three years. And what I found was that, understandably so, administrators needed me to be productive. They needed me to be there for productivity. And so I needed to see patients not only to take care of my family, but also to be sure that I was producing a salary for the administrators and producing a salary for the staff and the different people who were there. And I understand that. They were providing an opportunity for me to see patients, and they were taking care of my business. But what I came to realize was that unfortunately sometimes babies get sick, and sometimes mamas need to stay home when their babies are sick. And so what I came to the understanding and the realization was that I was going to have to start my own practice. And so I moved back to Northwest Missouri, which is where I'm from, and my brother was already in practice there. 2 of my brothers are doctors, and one of my brothers was already in practice there. And we decided that we would both incorporate, and then we would share overhead. And so that's what we did. And it worked beautifully, and our patients were well taken care of. And if I had to be gone or if something had to happen, in the meantime, I had a child who was medically complex. So my 3rd child was medically complex. So if I had to be gone, I could speak with my patients, I could take care of them, I could do what needed to be done for them, and they understood. So I will tell you, March 23rd of 2010, I remember exactly where I was when I heard that ACA had passed. I was walking into my clinic in Northwest Missouri, and I heard that ACA had passed, and I will tell you, I immediately got nauseated because I knew it was bad for my patients. Immediately, I knew that my days as a private practice physician were numbered. And I went in and I talked to my brother, and we discussed it. Awesome, thank you, 5 minutes. I have 5 more minutes to talk really quick. So anyway, we discussed it, and I will tell you that we went about our day, and we tried to make it positive. But immediately after it was passed, even before it was implemented, deductibles went up and premiums went up. And so I had patients who would come in to see me whenever they were not very sick before, and after it passed, I went from seeing 25 to 35 patients a day down to seeing 15 to 20 patients a day. And sometimes I wouldn't even see 20 patients. Usually it was more, it was closer to 12 to 15 patients. And when I would ask them, why are you not coming in? We know the progression of what happens. They would say to me, I cannot come in to see you because I cannot afford the deductible. And some of them would say, I can't afford the premium. I don't even have health insurance. And so a lot of times I would end up sending them to the ER because they were too sick for me to take care of in the hospital or in the clinic. So here was the problem. Here was the situation. When I had started my practice, I had contracted with Medicare and with some of the insurances. And part of my contract said I could not offer care to those patients for less than what I was contracted to Medicare for, or else it was considered Medicare fraud. So at a tune of $50,000 per instance, if my patients would come to me and they'd say, Doc, I can't give you my copay, and I can't afford the visit, my deductible is so high, but is there any possibility that I could just pay you $10 or $15, or is there any possibility that I would be willing to do anything I can or to pay you later? And I would say, I am so sorry. I can't, because if Medicare finds out that I'm charging you less, they can absolutely find me fraudulent. And so anyway, what ended up happening was I ended up moonlighting to keep my patients, to give them the care that they needed. And I ended up moonlighting and picking up shifts in rural ERs. And to try to keep my practice afloat. But unfortunately, it was hemorrhaging so much that I had to finally give it up. And sometimes I get emotional about that because I remember the faces of the people that I told that I would be there, that I would walk to the end of their cancer diagnosis with them, and I had to stop. And I had no alternative for them. And so an unintended consequence of regulations and bureaucracy is that I was unable to take care of my patients. And so when my practice closed, we left upwards of 5,000, close to 6,000 underserved patients without their doctor. Underserved patients in a rural area without their doctor. And that is an unintended consequence of ACA. I want to tell you another unintended consequence of ACA, the electronic health records. I work in rural emergency rooms. I have 1 minute, I gotta talk quickly. I work in rural emergency rooms. And just a few weeks ago, I had a little girl who came in, and to be ACA compliant, we had an electronic health record form, or health record. And I had to transfer this little girl. What happened was she had severely burnt her hand. She had a severe burn. She was 8 years old. And she came in and she was screaming. And I got her pain under control with some fentanyl, but she was pale and she was sweaty, and literally the skin was melting off of her hands. And in order for me to transfer her to the pediatric burn unit, I needed to fill out, in order to be MTALD compliant, I had to fill out the form. But in order to be ACA compliant, we had it on electronic health records. And so when I went to click on the electronic health record, the electronic form to get it filled out, I had an accepting physician, EMS was there on standby, parents had verbally consented. And when I went to fill out the form, I had the form filled out and the computer froze. And so for 10 minutes, the nurses and I sat there and tried to get the stupid computer to take the date, the right date. So for 10 minutes there was a child in my ER that I could not get transferred to definitive care because of an electronic health record that I could not get the form filled out and signed. And so that, I'm sure there were good intentions whenever that was put into place, but this was, unfortunately, unintended consequences of well-intended regulation. I'm just going to tell you something very quickly. So this is my goal. If we want health care for every person in this country, then this is what I would ask you to do. I would ask you to untie the hands of the doctors that want to give the health care to the patients. I would ask you that when you have a doctor that wants to give free care, then give that free care. We talk about other countries that impede the flow of the aid to their citizens, and we as Americans find that un-humanitarian. We as Americans get angry about that, and yet we are doing the exact same thing in our country. We are impeding the flow of health care to our patients when our doctors want to give it to them. And so I am asking you, untie the hands. Stop the Medicare fraud witch hunt that makes us scared to death to click the wrong button, scared to death to write the wrong diagnosis down, or to type the wrong diagnosis, or to click the wrong one of 40,000 diagnoses that might be considered fraudulent. Stop the Medicare witch hunt. Stop the whistleblowing that allows our coders, if they have an axe to grind with us, then they can actually upcode, do whatever they want to do, and then they can become a whistleblower and get paid for it. Stop that. That is not okay. And the other thing that I would say, just one last thing, is remove and end reimbursement for patient satisfaction scores. Because patient satisfaction scores have been shown to be inversely related to patient outcomes. So if I have a patient that comes to my ER and I know that they're selling narcotics on the street and I refuse to give them narcotics, I get a bad survey, I get a bad score. And so it decreases the amount of money that comes into my hospital. It doesn't affect my paycheck because I'm paid hourly, but it affects, okay, I'm ready to stop. But anyway, it affects it. So what I would say is that needs to be ended because it's not good for patient care. Thank you very much.